Morning. Our lecture today is the nervous system. The nervous system is one of the most complex systems in the body. It coordinates the body's involuntary and voluntary movements. ينظم الأعمال الإرادية واللا إرادية. The nervous system works in conjunction with the endocrine system to maintain homeostasis, means state of equilibrium, توازن, homeostasis. The nervous system has two main divisions, the central nervous system and peripheral nervous system. The central nervous system consists of the brain and the spinal cord. The peripheral nervous system is divided into the somatic and autonomic nervous systems. From the outside, the brain is separable into two hemispheres, each consisting of four lobes: the frontal, parietal, occipital, and temporal. The names of these lobes related to their location relative to the skull. The three principal parts of the neuron cell are cell body, the dendrites, and the axon. The cell body contains the nucleus. The dendrites project outward from the cell body. The axon is the part of the neuron that conducts electrical impulses. Synapse. The connecting point between nerve cells or between a nerve cell and a receptor or effector cell. The stimulus between the two cells is usually passed by chemicals called neurotransmitters. Hormones are typical neurotransmitters. When groups of neuron cell bodies occur within the peripheral nervous system, each one is called a ganglion. Plural is ganglia. Grouping of axons anywhere in the body are called nerves. Myelin sheath is a white fatty material that covers the axons to provide protection and electrical insulation to the nerves. Ventricles are cavities between the cerebrum and brain stem. The major parts of the brain include the following: cerebrum, the largest part of the brain. There is an outer layer of gray matter protects the cerebrum called cerebral cortex. B. Cerebellum. It is situated beneath the cerebrum and it is also consists of two hemispheres. C. Diencephalon. This part contains both the thalamus and hypothalamus. D. Brainstem. The meninges are three-layered membranes surrounding the brain and spinal cord. They absorb physical shocks that may damage the neural tissue. The outer layer of the brain and spinal cord consists of dura mater. The middle layer is termed the arachnoid, the inner layer called pia mater. Disorders of the nervous system. A. Brain trauma. Number 1. Concussion. Cerebral concussion, violent shaking of the brain, may result from a fall or blow to the head. Number 2. Subdural hematoma. Sub under dural pertains to the dural layer of the meninges. Hematoma, blood. Oma, tumor or collection of, is a collection of blood trapped in the subdural space beneath the dura mater. Number 3. Epidural hematoma. Epi on top of, dural pertains to the dural layer of the meninges. Hematoma, blood, is when blood collects between the dura mater and the skull. B. Vascular insults. A. Vascular insult is an injurious trauma to the blood vessel. An injury to the blood vessel in the brain may result from aneurysm, localized dilation of a basal wall or chamber that ruptures, or an embolus or blood clot that blocks the blood flow to the brain tissue. 1. Cerebrovascular accident, also known as stroke, transient ischemia attack. Tumors. Tumors are lesions or neoplasms that may cause localized dysfunction, producing an increase in intracranial pressure. D. Systemic degenerative diseases. The degenerative diseases develop slowly over time. Usually there is progressive deterioration that may start by affecting individual components in the body, then end up involving one or more body systems, like multiple sclerosis, MS, Parkinson's disease, Alzheimer's, seizure disorders. One example of seizure disorders is epilepsy, is a chronic disorder characterized by recurrent seizures that result from excessive electrical activity in the brain. There are two types of epileptic seizures: grand mal seizure and petit mal seizures. F. Behavioral disorders. Number 1. Anxiety disorders. Common examples of these conditions include obsessive compulsive disorder and phobia, which means an irrational fear of specific situation or things. Number 2. Mood disorders. These include depression. 3. Psychotic disorders. These disorders are very serious and dangerous conditions, such as schizophrenia. Procedures and practitioners. Computerized tomography, CT scan, magnetic resonance imaging, MRI, electroencephalography, EEG, lumbar puncture. The medical specialists who diagnose and treat the nervous system are neurologists, neurosurgeons, and psychiatrists. Neurologist, a medical specialist who treats nervous system disorders. Neurosurgeons, surgeon who specializes in operations on the nervous system. Psychiatrists, a medical doctor who specializes in the diagnosis and the treatment of psychological disorders. Psychologist, a non-medical specialist in the diagnosis and treatment of psychological disorder. Finally, we come to the pharmacology, or the drugs used in the system. First, the sedatives or hypnotics, drugs that are used to induce calming effect or sleep. Anticonvulsants, drugs that are administered for seizure activity. Some meaningful terms: neuronerve, neurology, medical specialty dealing with the nervous system. Neuralgia, pain in the nerve. Neuropathy, a disease involving the cranial, central, or autonomic nervous system. Cephalohead, cerebello, the cerebellum. Cerebro, the cerebellum, also brain. Encephalo, brain. Myelin, in connection to the nervous system, is referred to the spinal cord and medulla oblongata. Psycho and mental, referring to the mind. Cerebrospinal fluid, the fluid and around the brain and spinal cord. Paresthesia, numbness. Encephalitis, inflammation of the brain. Cerebral thrombosis, blood clot in the brain. Meningitis, inflamed meninges. Amnesia, loss of memory. Aphasia, loss of speech. Dysphasia, impaired speech. Myelitis, inflammation of the spinal cord.